Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
The Senate has eliminated public media funding, money that helped us reach rural Idaho with wildfire warnings and critical emergency alerts. Without it, voices may go silent in places that need us most. And it's not just Idaho. Our regional partnership through the Mountain West News Bureau is also at risk. We're the front line of trusted information in the West, and we're depending on you to keep it going. Donate now at boisestatepublicradio.org. There's no time to wait.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. In a rare disclosure from the White House, officials announced late last week that President Trump was diagnosed with a common chronic vein condition. Now, this revelation is offering an unusual glimpse into health of the oldest person ever elected to the U.S. presidency. And it's also raising questions about what the condition is, how common is it, and does it mean there could be other underlying health issues? Well, Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak, is joining us now to talk more. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. Okay, so Dr. Pate, can we start out with what is this condition the president has?
Yes, what he appears to have, and certainly the pictures that I've seen are totally consistent with it, is a condition called chronic venous insufficiency. That is a common disorder. It typically is associated with aging. We rarely see it in people under 50, but after 50, we see it with increasing frequency as people get older and older. And certainly in people President Trump's age, my age, we would expect, at least 5% of those people that age to have this condition.
So, Dr. Pate, as you said, fairly common, but the White House definitely downplayed the condition as nothing serious at all. So, in your medical opinion, is a condition like this, nothing to be too concerned about?
Not to be too concerned about. There are some issues that I discussed with my patients about it. First of all, what has happened is this is a problem with, again, associated with aging, where some of the veins kind of give out. Specifically, inside the veins, there are valves that help the blood move in one intended direction, which is back towards your heart. So your arteries take your blood out and deliver it to the tissues. The veins return it to the heart. But what happens when these valves in the veins get weakened, they no longer become as effective in returning that blood to the heart. So what happens, and how this condition was noticed, was by pictures that showed that President Trump had significant ankle swelling. And that's how most of my patients detect this, that their feet and their ankles are getting swollen. Sometimes it's bad enough a good part of their lower legs are swelling. But generally, it's more of a nuisance. Typically, in milder cases, when people are able to get their legs up, especially overnight when they have their legs up, they're reclined, the swelling will substantially improve. But there are risks to that swelling. One is that, and of course, you would notice from the president's shoe wear, he has to wear dress shoes that are typically very constrictive and not flexible, and that can put a lot of pressure on the skin, and they have to be careful that it doesn't disrupt the skin, because people that have this condition then become very susceptible to infections. So there are things that we can do. Losing weight typically helps. Exercise typically helps. Most effective thing is elevating the legs. But a lot of times when my patients are finding that these simple measures aren't working, then we result to things like compression stockings, and there's other things. But ordinarily, it's a nuisance, not a medical threat.
Mhm. And I wanted to clarify that, Dr. Pate, because since this was revealed by the White House, there has been so much speculation about this not being serious at all. To the fact that, well, the White House is covering up even greater health issues. So I think it's important that people understand what this condition is, and frankly, from what you've said, nothing too serious.
That's right, and of course, this reflects a problem that, ironically, his administration has stoked by spreading a lot of
Hmm.
disinformation, particularly from his Secretary of Health and Human Services. So this is the problem. We're seeing it manifest in a number of things where. Now, the White House, the administration is trying to downplay some things that are kind of getting a life of their own because we're now living in this sphere where you can't always trust the information you're getting. But yes, it's certain that the more serious conditions would be, that you'd have to worry about are heart failure, liver problems, kidney problems. But I think we can be assured that the White House physician has already ruled those things out. And this is very typical. And I think nothing for anybody to get worked up about or concerned about.
So, what about these spots on the president's hands that we've all seen pictures of that he's tried to cover up with makeup? Dr. Pate, can you talk about what this is?
Yes, and I heard one physician commentator linking this with his chronic venous insufficiency, but this is actually I've seen the pictures. He has a very common issue. It's also associated with aging, but it's not the same problem. It's not the chronic venous insufficiency. What happens, and I'd be surprised if any of your listeners haven't noticed this in loved ones or friends who have gotten older, is that with age we bruise more easily. And while chronic venous insufficiency typically involves the legs, just as we discussed, this problem is much more commonly seen on the hands and the arms. And specifically, what happens is as people get older, you lose the subcutaneous fat under
Mm,
the skin, and so a lot of times in elderly folks, their skin actually almost kind of looks like crepe paper or something. It gets very
hmm.
thin. It's fragile, and then this condition can get even worse if they've also, on top of that, had a lot of sun exposure, because that weakens the skin and stiffens it. And what will happen is that the superficial blood vessels right under the skin are much more prone then to breaking when there's pressure. And so, what you would see is you would see this on the back of the hand. You would see this sometimes up on the arm, and people will tell you that, well, it just bumped into something and I got this bruise that they normally wouldn't have a lot younger. In President Trump's case, the White House was mentioning all the people he shakes hands with, and that could easily be the explanation. We also see this problem, and they just typically look like bruises. It's called
Hmm.
senile ecchymosis, but that senile is a reference to age, not to mental capacity. And so it's very common. And it's worse in people that, as commonly happens in people that are that age, that are taking aspirin or blood thinners. That makes it even much worse.
So basically, Dr. Pate, these seems to be very typical conditions for an aging individual. The president is 79 years old.
You are absolutely correct. So both of these conditions extremely common in people his age, and frankly would be surprising given his health history, given his history. Particularly a lot of plane rides, meeting and greeting a lot of people. It'd almost be surprising if he didn't have these, but they're if I was his physician, I would make note of them, but I wouldn't have any concerns other than recommending that we exercise due care about caring for the skin so that it
Hmm.
doesn't tear, doesn't rip, doesn't cause a bigger problem. But otherwise, these are really not of any consequence to his overall health or his ability to perform his functions.
Well, with that said, though, Dr. Pate, I think that why this maybe blew up and why there's been so much speculation is that President Trump's entire campaign was based on his health and his vitality, right? And going after former President Biden about his age and his mental acuity, et cetera, et cetera. They are 3 years apart in age. That is not a big age gap. So, what does this tell us about this idea of President Trump having such tremendous health and vitality? Again, I mean, not to be disrespectful, but I mean, he is an elderly individual.
Well, that's right, and I think that a lot of this is stoked for all older presidents, like you mentioned, President Biden, President Trump. And now
Hmm.
that I mean, really since President Reagan, I think, now that we've had so many older presidents, even comparing to what we had in the past, I think the big problem is there is not a lot of transparency. What you as a reporter are used to getting is some White House statement from the physician. Oh,
Hmm.
President Pate, he's just the example of perfect health and all this, and you get very few details. And I think that what happens is that we all know that presidents are going to be concerned about what information's released. In the case of President Trump, you have to certainly there's many examples where you have to be very careful what you say and release. And I think we could take care of a lot of this if we just required far more disclosure and not a statement from the White House physician, but actually have some standardized records that these medical records ought to be released and give them to the public. And then physician commentators such as myself, we can actually look at the medical data and then we can tell you, yes, these are all fine, these look good. Or we can say,
Hmm.
hey, they're kind of glossing over a problem here.
Well, you make a good point, Dr. Pate, because there wasn't transparency, I think it's fair to say, around President Biden's health records as well. So this is not, I think, a Republican or a Democrat issue. It is about transparency. And then when you look at Presidents Obama and Clinton, when they were both in office, they were much younger. There was a lot of transparency around their health records. So it makes you it makes you wonder, well, how much is this about age and the ability to do such a job as you age?
Well, and you're particularly right. I mean, the I don't have any problem with, especially now that I am an older person, with older persons having these kind of jobs. However, when we're talking about the leader of the free world, we have a right to understand: is there a likelihood that this person can finish out their term? Is there a likelihood that this person can function to the degree that's necessary? And that's a very demanding job. And we've had examples in the past where, in decades ago, where presidents were not honest with us, and some of those presidents were not able to effectively perform all their
Hmm.
duties and all. So I think that we don't need to know everything about a president's health. I think you should try to keep some things that are not material. Let's keep those private. They should be entitled to that. But I think it would be very easy for us in the as physicians to come up with a standardized list of things that these are pertinent questions that we should have answers for. And instead of somebody representing what those results are, they should just share those results.
Dr. Pate, some new information recently came out. It was, in fact, published in the Journal of American Medical Association Oncology, and it discussed the effectiveness of the COVID booster for people with cancer. Can you tell us about this? Because interesting, I think, information coming out.
Yes, and really affirming what we, with data, what we could already kind of tell empirically, and that is, as you know, we've been discussing over the course of the pandemic that some people are at much higher risk for severe disease. And severe disease in COVID, meaning that you get hospitalized, that you require intensive care, or that you die. And among those that are at higher risk, we talked about older people, if you're markedly overweight, if you have certain immunocompromising conditions or taking medications that would affect your immune system. Cancer is one of those that we have realized for some time. Those patients are at higher risk for severe disease. Now, keep in mind not all cancers are equal. And so some patients with cancer where we can just address that with surgery, they're going to probably be on the low end of that increased risk. On the high end is going to be those people on chemotherapy, those people with blood tumors, that leukemias, those kind of things that even more drastically affect your immune system. But what this study did was to look at what was the outcome of people with cancer, and they're grouping them all together here, of getting the booster shot back in 22 compared to those persons with cancer that did not receive the booster shot. And what they showed is that it decreased their risk of hospitalization with COVID by 29% and decreased their risk of ending up in the ICU by 36%. So, again, the booster doesn't eliminate your risk, but it does
Mhm.
significantly reduce your risk. And I think that there was too many people thinking that, well, I'm going to have protection from my initial set of shots or an earlier infection. And clearly, what we've learned over the years is yes, you do get some protection for some period of time, but that declines. And these boosters are a really important strategy to keeping those, especially those at high risk, decreasing the chances that they're going to get severe disease. And so this study, I think the really the most surprising part of the study was how many of these cancer patients weren't getting booster shots, and that's not clear whether their doctors at that time were not clear whether it would even be worth it, given that maybe they were on immunosuppressive drugs, or whether this was patients not realizing the importance of it. But if you are undergoing cancer treatment now, please know that you are at some increased risk, and you should even still continue to get boosters.
So, Dr. Pate, let's talk about another study that came out. This was published in Nature Communications. This was British researchers, and it is the fact that brain aging may have sped up during the pandemic, and even in people who didn't get sick from COVID. So, tell us about what they found in this study, because I read it and I was thinking to myself, really? I mean, none of us are going to get out of this, like no matter what. I'm not trying to make light of it, but I mean,
Right. Well, it's a fascinating study, and what it shows is that, just as you said, the pandemic takes a toll on everyone. And
Hmm.
so, frankly, it's a good reason that we ought to pay more attention to preventing future pandemics, because you're not going to escape unscathed. And what this showed is that, just as you said, there was some evidence of brain aging, and that is measured by doing scans, and we can measure the volume of the brain. And what we can see is that in normal aging, the brain does shrink some, and what they were able to show in their study is that taking people that had brain scans before the pandemic and then who got a brain scan during the pandemic, they were able to show that on average, people's brains aged about 5.5 months more than would have been expected for that gap in time. And so now what we don't know is how significant is that? Is that
Hmm.
of any future consequence to their health and functioning? We don't know the answer to that. But what it seemed to show is that that part is not infection related. That would seem to be more related to people reduce their activity. May have stopped going to gyms or yoga
Yeah.
classes or whatever. They had social isolation. They were under psychological stress, and we remember all the drama and intensity of emotions and everything happening there. And I think that we are just learning a whole lot more about the brain, and that we are realizing that stress itself can have an impact on the brain. Now,
Hmm.
they also looked at people that did have documented COVID infections. And in addition to that brain shrinkage, those people did have evidence of a decrease in cognitive functioning, particularly the processing speed, their mental flexibility. We've had other studies that have shown us lots of potential effects from COVID infection on the brain, including a risk for at least a period of a year of an increased risk for strokes. We've seen that people that are predisposed to dementia, getting COVID can accelerate the development of the dementia. Those that have dementia can deteriorate. And we've even seen some more recent reporting of an increased frequency in some psychiatric conditions after COVID infection. We're learning a whole lot more, and I think we will continue to learn more. I think the good news is that, and one thing to take away from this is that we need to find balance in our lives. And many of us are in stressful jobs or in stressful sociological
Hmm.
situations, and we need to find healthy ways to mitigate that stress. Make sure that you're engaging exercise. We have study after study showing us the benefits of exercise on your brain health. Make sure you're getting proper amounts and quality of sleep. Make sure you have social interactions. Make sure you take time to do things that you enjoy and find stimulating. If you have hearing loss, we know that correcting hearing loss can delay onset of dementia. And of course, if you have elevated blood pressure, make sure you control the blood pressure. So there's things we can do, but stress is bad on our bodies, and it appears it's bad on our brain.
Well, and another thing that I found interesting about this study, Dr. Pate, was as you mentioned that in this study group, people with who got COVID, they were the ones that also showed cognitive deficits. And one of the researchers said that this may eventually help explain certain syndromes like long COVID, Because this has been something, Dr. Pate, that you and I have talked about for the last 5 years is why do some people get long COVID and why do other people not get it?
Well, absolutely. And we are learning a whole lot more about long COVID and what the mechanisms are to how it is happening. And unfortunately, we're also recognizing that long COVID is much more common in kids and even infants and young children than we had previously thought. And of course, there was another similar study to this that was done on teenagers, and it showed even more dramatic aging. We know that before you're in your early 20s, your brain is still evolving and developing and so one thing that is of concern is what is the consequence of all these potential infectious insults to the brain, but also the stress. And of course, been a lot of discussion about cell phones and social media and all that impact. I think we're just going to learn so much more, but I think there's reason to be concerned that we need to probably do a better job of protecting our children. And a fantastic way to do that would just be to improve air handling in schools. We already
Hmm.
know that the quality of air determines their cognitive performance, their exam performance, their so many things. It's not that we're helpless. We just have to make a decision to do some things.
And yesterday, Dr. Pate, the World Health Organization warned of a virus epidemic that could sweep around the globe. I'm not even going to begin to try to pronounce what this virus is. I'm going to leave that to you. So, what is this virus? What do we need to know about it?
So it's chikungunya, and the reason it has a strange name like that is that it was named by the people that were first afflicted with it when it was discovered. So that is actually a word in the Kimakonda language that it literally means that which bends up or to become contorted. So that already gives you an idea about what this infection is. So the chikungunya virus is transmitted by mosquitoes. And it causes fever, it causes severe joint pain, and which can be disabling. And that's where the name comes that because of the joint swelling and pain, that people actually get contorted. They are in terrible pain. They can't ambulate normally. Those kinds of things. Chikungunya is usually not fatal. It can be. The case fatality rate is less than 1%, but it's just not fun. You do not want to get this infection. And what the alert is that we have now seen this virus spread to 119 countries. And while it typically has involved more of the tropical and warmer climates in the southern hemisphere, what we have seen is that the one mosquito that transmits this disease, the tiger mosquito, has been migrating further north and perhaps related to the climate changes that we've seen. And in fact, oh boy, I think it was 2014, we actually had an outbreak of chikungunya in Florida and Texas.
Mm.
Now we haven't since 2019. We haven't had any more problems, but there's many of us concerned that it is coming to the United States as part of this latest epidemic that you've mentioned. We've seen local spread in France. So that means we are definitely susceptible. We're going to have to be on the lookout and take measures to address this if it spreads.
And Dr. Pate, when the WHO made this announcement yesterday, they said that they're doing this because they're seeing the same early warning signs that they saw 20 years ago when there was a major epidemic that swept across the Indian island. I mean, it hit small island territories, but it also really hit, I think, more than 500,000 people got this virus. So, is that one of the reasons to start giving the heads up now? And again, trying to be proactive so that we don't have an epidemic on our hands.
Exactly. And I was pleased to see our federal government issue some travel advisories. For people who are going to be traveling to these areas that currently are experiencing an uptick in chikungunya or are expected to potentially be involved in it, this includes things like countries like Brazil, Colombia, India, Mexico, Nigeria, Pakistan, the Philippines, Thailand. You can look at our government's Department of State travel warnings or the CDC travel warnings, and just know that if you're going to be traveling to these countries, this mosquito, unlike a lot of other mosquitoes that kind of feed at night and more likely to bite you at night and all. This one will bite you in the morning and afternoon. And so you need to take steps if you're going to be out, particularly as to your clothing, mosquito repellents, those kind of things, because as I described and as the name itself means, you do not want to get this condition.
So, Dr. Pate, Sunny writes in and says, I'm 77 years old with no health concerns. My latest COVID booster was 6 months ago, so I can now get a 6-month booster. Should I get the latest vaccine, and will it protect me from the latest Nimbus? I believe is what they wrote.
Yeah. So, yes, at that age, certainly a good idea to stay up with the boosters. And we are beginning to see a new surge. So, if this person is going to be at a particular risk of exposures, it might be a good idea to go ahead and get it now. The new updated 2025 2026 vaccines are still being rolled out because these companies just got their guidance from the FDA in May. So I'm not sure how easy it is to find the new updated versions. If he's not going to have a whole lot of exposures, I'd wait to see over the next month. Usually we see these roll out in around August or so, and get the new updated version. And yes, it is protective against Nimbus and the other strains that we've talked about because they haven't markedly changed. So should be good shape. But if you need something now, go ahead and get what's available. But if he can wait, I'd wait for the updated 2025 2026 vaccine.
And then Anna asks, can you please ask Dr. Pate if he prefers Pfizer or Moderna or the other one? Is it Nova?
Oh, Anna, you're putting me on the spot here. Uh, my my hesitancy in answering is I'm afraid that listeners will take it as a ringing endorsement for the one that I prefer, and then because it's also sometimes hard to find, and then I'm afraid that they will be so dedicated to getting that one that they won't get what's available. So first, let me
Mm.
start out by saying there's not a huge difference between all three: Pfizer, Moderna, and Novavax. But there are some differences. And the best vaccine is the vaccine that you can get because a vaccine doesn't help unless you get vaccinated. So get what you can find. However, because I do want to answer Anna's question, personally, I do think that there are some factors that weigh in favor of the Novavax. Novavax is also a particularly good choice for those that have just been significantly frightened or concerned about all the mRNA vaccine discussions, because it is not. It's a protein subunit. I don't think I get mRNA vaccines. And in fact, I've gotten all three over the past years. But I think the one that I would get at this moment would be the Novavax, but that's not a strong recommendation. So again, when you have the opportunity to get vaccinated, there's a good chance they won't have that. Get Pfizer, Moderna, whatever you can. Be sure to get. It's more important to get vaccinated than the particular vaccine.
Well, and Dr. Payne, I know that you and I have had discussions offline about this, because I think I've gotten all the Pfizer is what I've gotten. I've never had any side effects. I know my husband's had Moderna. He's had minimal side effects. Our oldest son has been, I mean, he's what you hear about someone who's feverish, gets the chills, all of that. I mean, you can almost time it and he does not feel good for like 24 hours. And I remember you saying, so next time, if we can find it, he should get the Novavax vaccine, because he may have milder symptoms. Because I told him he's getting the vaccine. I mean, he doesn't have any choice at this point, since I'm in charge still.
Yeah.
But I mean, should people maybe think about that as well? Like I said, I have never had any side effects from any of the vaccines I've had.
Right. So that is a consideration. And people what you described, like, for example, myself, when I have gotten Pfizer or Moderna, I'm in bed for 24 hours and feel like I've got the flu, but then I'm over it and I'm fine. But Novavax, I have no reaction to it all. And the studies show Novavax is far less reactogenic, is our medical word for that. In other words, doesn't produce those kind of symptoms. And so when you told me about that problem, what I pointed out is, as long as he's over age 12, then, because you can't get Novavax under that age, as long as he's age 12 or more, just get him the Novavax, because it's far less reactogenic. The other advantage to a different vaccine, for example, when your sons are at the age where there could be the concern about myocarditis and all, that is a problem more associated with the mRNA. And so Novavax could be something there. However, there's a couple of things we've learned about that. One is that risk of myocarditis, we're not really seeing that now. And it appears to be because the first two vaccines were recommended to be 2 months apart. And that appeared to be the significant factor, that even for people that had previously had the myocarditis, if you just spread it out further, they tend not to get it again. The other thing is that is notable is I had mentioned to you that one of the reasons that some kids were having, as they cross the line from being the kid to being over 12 and getting the new formulation, that some kids were having more reactions because the dose increased. Well, Moderna has just, their new version is going to be about 20% of the previous dose. They've done the studies to show that they could refine that, lower the dose, and it's actually even slightly more effective. And because of that, there'll be less risk of side effects, and it should be a little bit less reactogenic. So that's another option.
All right. Well, as always, Dr. Pate, we so appreciate you. We've been speaking with Dr. Pate, former CEO of St. Luke's Health System, as well as co-author of the book, Preparing for the Next Global Outbreak. Remember, if you have a public health question, send us an email, idahomatters@boisestate.edu. This is the Idaho Matters podcast. I'm Gemma Gaudet.
These days, there's so much news, it can be hard to keep up with what it all means for you, your family, and your community. The Consider This podcast from NPR features our award-winning journalism. 6 days a week, we bring you a deep dive on a news story and provide the context and analysis that helps you make sense of the news. We get behind the headlines. We get to the truth. Listen to the Consider This podcast from NPR.